Welcome back to our second part of the Lyle Style Show. Now, this is a special show again. We had a Dr. Pet segment with Charlotte, you know, and we have two little kittens. And now we have our guests on the show, Patricia and Richard, and they do service for, what is it, service for?
Therapy and
therapy, that's right.
Therapy dog. Tarwi is a therapy dog, but he's also a service dog, which is pretty unusual.
And therapy dog,
yes.
both is kind of the same thing.
Yes, with some difference.
Some difference? Okay, because I remember seeing y'all at the store and whatnot, and it was interesting, me and my lady friend and whatnot, and we said, wow, that dog is interesting. Look at how that dog is responding to people and whatnot. So
well, he's been very well trained, a lot of hours, a lot of time.
Well, I want to welcome to the show, and I want to just talk to you a little bit about Toby. His name is Toby.
Yes, and this is Lucy.
Lucy. Now, Lucy's in training, though.
Yes, she's in training.
Now, Toby's a veteran. Toby's been doing this for a while.
Oh, yes.
And okay, now what is service and therapy? What is that?
Okay, well,
detail.
Therapy dogs and service dogs are both very hardworking dogs. I mean, there's very little difference except for the access they're allowed. Service dogs are allowed to go anywhere and everywhere that we go. General public, if the general public can go there, they can go there.
Okay.
For instance, if we were in a restaurant, they can come to the restaurant. Now, we aren't allowed in the back kitchen, so of course he isn't. But if we want to eat in a restaurant, go to a grocery store, the doctor's office, he's been everywhere you could imagine. And he just lays down on the floor and is very quiet and obedient, doesn't make any nuisance. He never barks indoors, never makes mistakes indoors, accident-wise, hygiene-wise. When he was first in training, like Lucy, he had a few accidents, but we took him to places at first to initially train, like Petco, PetSmart. We got special permission at Walmart to train him in there and just stayed away from the main food areas until we knew he was thoroughly trained. And it was a very good learning experience. By the time he was 5 months old, he was doing so well that he was already volunteering. We volunteered him at St. Luke's Hospital in Cedar Rapids. And he's done 41 volunteer hours working with, doing therapy with all kind of patients, palliative care, hospice. He's done the maternity floor with the moms-to-be, children. He's in his almost 6 years. He'll be 6 years old in August. We've done the READ program, which is Reading Education Assistance Dogs, when Garner Elementary opened their first year. He had his own little pod of first and second graders. And they would earn points through the week, and then their name would go in a jar, and then the teacher would draw from one classroom one name, and there'd be 6 children a week that would get a book and read to Toby for 15 minutes.
Wow, that's wonderful.
They found that it improves children's reading scores and behavior.
Okay, now, what is Toby's specialty? Does he? I know he's a therapy dog, he's a service dog, but is there a particular specialty that he really does well, or does he do all of them?
He's pretty multifaceted. As I was saying, he's also, besides a therapy dog, a service dog. And as I was telling you, the difference is the therapy dogs have limited access. They might go to the hospital, or a senior citizen's home, or an assisted living place, or a school situation like the Reading Education Assistance dogs. It could just vary. We've worked with patients who had a stroke. So believe it or not, it might not seem like to us, but just for a person with a stroke to get their thumb to work and work this. Or there is a reason besides just fashion for these bandanas to untie and tie the bandana, to hold a brush and brush him. That's all physical therapy. We've taught him to take commands from other people. So supposing a child or an adult has a speech problem or impediment, they have to pronounce it closely enough to what it really is for him to perform the function. And let's face it, a speech therapist sitting there getting you to pronounce the sound, or a cute dog.
A cute dog.
Yeah, I
Yes.
thought you. Yeah.
Yes, yes.
And so a service dog is that's the main difference. But therapy dogs work every bit just as hard. It's just their access is limited.
Okay. And I see he's looking at himself a lot. So he admired himself in the camera, which
very
lets me know
smart.
that he's smart. He say, hey man, look at the handsome lad right there. But okay, now with Toby, like I said, because I saw you in Target and whatnot. You would and stuff like that. Now, and so you've been doing this since your days in Vinton.
With huskies.
You had huskies. Now, what do you change from huskies to terriers?
We got older, and we don't have as much room. We relocated to North Liberty.
Okay.
And we live in a mobile home court, and we have a much smaller yard. And we'd already had to put 3 of our Siberian Huskies down. They were old already anyway and had illnesses they couldn't be fixed from. Well, that's kind of part of companion animal ownership too, you know.
Yeah.
And the funniest thing is they could have been classified as service dogs back then, and we didn't even know it.
Oh.
Because the definition of a service dog is there's 2 criteria. The person has to be disabled.
Okay.
Or in close association with the person with the disability. And the dog has to be trained to do a specific task or service, thus the name service dog, for the person that meets his particular or her particular disability.
Yeah.
And so a lot of times you don't get to pet a service dog. They don't even want you to.
Why is that now? I'm fascinated. Why is that?
Because the service dog is so trained, they have to cue in on you totally. And now for some people, it's vital that their service dog focuses on them constantly. For instance, a seizure alert dog, they're constantly looking at your eyes, your pupils. They'll even notice subtle changes like changes in the dilation of your pupils, the coloring of your skin. And as you know, your body puts off pheromones.
Right.
A person that's going to have maybe a diabetic episode. That's when we discovered, besides being a medical alert dog for my husband for PTSD and me for anxiety, about 1.5 years, 2 years old, he demonstrated he was also a medical alert dog. He taught us.
Really?
We were slow to catch on. It took us 2 months to realize what he was trying to teach us. We taught him to ring a cowbell to go in and out of the house because he's so non-barky. He didn't tell us when he had to go to the bathroom. We got him a bell. As soon as he learned to ring it, he rang it and went out. Well, one day, after he was about 1.5 years old, he quit. He rang the bell, but he wouldn't go out. He stared right at me, or he'd put his head in my lap. And sure enough, within an hour or so, I'd be really sick with a migraine. He wasn't probably detecting the migraine, but migraines can be triggered by low blood sugars,
Right.
just as well as high blood sugars. And I think he was trying to tell me, eat something, you type A person. Quit trying to do that last thing and eat. If I'm in a store, of course, we don't have a bell for him to ring. He won't jump up unless he's invited up. You can pat your leg and he'll invite.
Right.
Otherwise, he's been trained to sit and wait till he's been invited because of the therapy work he does. In public, he'll jump up on me and lick my hand. Now for Rick, if he senses he might be having an episode or not feeling well, he'll get between him and the other person he's talking to and try to get him to leave the area.
Wow, wonderful. That is
And
marvelous.
he learned all that on his own. We just taught him all the basic commands.
And then he just caught on from there.
Well, we were slower to catch on. It took us 2 months to realize what he was telling us, but yes.
Wow.